Many states that relaxed quarantine measures are now seeing rising cases of coronavirus. And there's still the fundamental question about working in the midst of a pandemic. How do we stop people from getting sick on the job?
I think there are really important lessons to learn from the past. The messages that we were hearing during the H1N1 pandemic were similar to what we're hearing now. Stay home. Don't spread this to other people. And many people did not have a real choice to stay home. And we're seeing that now.
We begin with swine flu, now widespread in 46 states.
In the spring of 2009, a new H1N1 influenza virus known as swine flu was first detected in humans. That summer, a pandemic was declared, and it was in the fall that the highest rates of infection were reported.
They're going to work where they're around other individuals, touching their face inadvertently, touching doorknobs, high contact areas. You can see how that number can spread so easily. I myself was sick. I was supposed to travel for work. Being a public health person, I knew that wasn't the best thing to do to put other people at risk. I was able to stay home until I didn't have a fever anymore, until I felt better, because I worked at a place that provided that benefit. But for people who don't, I can see why that's such a hard decision to make.
Well, if you get the H1N1 flu, should you stay home or go to work? It's a tough choice millions of Americans are making because they have no paid sick leave.
We know that the workers who are most in need are least likely to have access to paid sick leave. It's overwhelmingly low-income workers, workers of color, people who work in small businesses that just tend not to have access to these types of benefits.
A week off of work would be really bad. That's like rent.
And it turned out that about 5 to 7 million people are thought to have gotten the H1N1 virus because their coworkers went to work sick with the disease.
The federal government has been telling people who have fevers or sick kids to stay home to slow the spread of the H1N1 virus. It is believed the rate of infection could be cut in by a third, that is, if infectious folks didn't go to work or school until their fever was gone.
So Congress began debating a federal emergency paid sick leave policy, as well as a potential for something longer lasting.
According to Congress, 57 million Americans don't have paid sick and medical leave. That puts the U.S. in the company of only a handful of nations that don't guarantee sick leave for citizens.
But there was also pushback against the measure, and some small business owners were especially concerned.
It's a huge challenge. It is
hugely expensive.
It is a hugely expensive challenge to put on top of a restaurant in this, anytime, but especially in the current economy that we're in.
When we look at what happened with H1N1, there were hearings, there were debates, and we still do not have a federal paid sick leave policy.
But in recent years, low-wage workers have pushed some states and cities to pass their own legislation. And the difference between states that do mandate paid sick days and those that don't has given researchers a window into the effect the policy can have on containing an infectious disease.
So we see when we compare states that implement paid sick leave and compare them to states that do not, we find that influenza-like illness rates, or basically flu rates, decrease significantly in the next couple of months and even years.
We're dealing with COVID-19 right now, but these issues are relevant for the seasonal flu, for other types of illnesses, other types of infectious diseases. So paid sick leave would not at all stop coronavirus from spreading. But what it could do is really help to contain the risk of transmission to other individuals.
In March, Congress passed emergency legislation requiring some companies to offer paid sick leave through the rest of the year and offering tax credits to cover those costs. But the bill excluded many people, including a lot of essential workers.
A lot of us are really literally making the decision between, our health and our financial security right now.
But just having access to a sick day doesn't mean someone will actually take it. In a survey that asked employees what they think of coworkers who come in sick, most people say that person is showing dedication to the job.
My fever has gone up a couple of degrees in the last 30 minutes. Nights are tough. I've lost 13 pounds in 3 days.
We had suggested you not work right now. I mean, I know you're incapable of not working and talking about this, but just for the record, we did suggest that.
Work is so important to most people's lives. We live in a society where work is important to our material well-being, a central part of our identity, our creativity.
Employees say they often power through because taking a day off could affect job security. Those concerns have heightened during this pandemic, when unemployment is at its highest rates since the Depression.
The current situation right now is so precarious in so many ways. Economic insecurity is so high. When people may not be so sick that they have to be bedridden, that they might try to go into work because the cost of not going to work or not continuing to be productive is so great.
And businesses are also struggling to stay afloat during a pandemic recession. Business groups have cautioned against making the 2020 expanded paid sick leave measure a permanent mandate.
It's very easy to say, oh gosh, paid sick leave is a wonderful benefit, everybody should have it. I don't disagree, but is the answer telling every employer, thou shalt provide it?
Unlike some countries that offer government support for paid sick leave, in the United States, it's largely left to the employer.
The workplace has an enormous role here that it doesn't quite have in other parts of the world.
Though there are debates about the economic impacts of paid sick leave policies, a recent review of studies of workplaces that were mandated to offer sick days found that most employers reported that it didn't significantly impact their bottom line.
Whether it's through the workplace, whether it's through state plans, health is important, work is important. And when we sit back and we look at how our policies create barriers to helping people to stay healthy and helping workplaces to be healthy and productive, then we haven't learned anything.